All right, welcome everyone. Welcome back to the Good News Network. I am Michael Reynolds. This is my good friend and brother, Chris White. Um, we are here for another episode to share some more good news with you all. For those who haven't been around for a while and maybe have forgotten, or those of you who may be new to our show, just want to let you know who we are and why we do this. Chris and I have known each other for a long time. We've had a lot of conversations about, we share life together, and over a series of time, we were having a conversation about all the good things that we were experiencing, and just realizing that that's not generally what we hear from
Mhm.
other sources around us, and there's a
No.
lot of outlets that don't necessarily highlight on that. And we thought, it would be a really cool thing if there was a place where people could hear about the good things that are happening in people's lives and in their communities. And so, we couldn't find it, so we decided to be it. So that's what we're doing here, is really just kind of um, giving folks an opportunity to share the good work they're doing, good things that are happening in their lives. So yeah.
Exactly.
And then to also kind of give an opportunity for people to get connected, to learn about resources in their community,
Right.
and if there's a way that they want to get involved with those, either to utilize them or to support them, we want to give that opportunity as well, because serving others is really a huge aspect of well-being for us, so
hmm
for all humans. So
hmm
cool. So welcome, Chris. What's
Hey,
happening?
thank you, brother. I'm well. I'm looking forward to this day and just thankful for the love in my life
Yeah.
and people who are just taking care of me and supporting me. And boy, I'm I don't have anything to complain about, brother. I think
Oh, come
I'm thinking.
on, man. It's
No,
got to be
I'm
something. No.
No, I'm so very thankful
Yeah.
for this beautiful day today. So thankful. I'm
Awesome.
excited about this show, this
Yeah.
and getting to know our guest and the work that she's doing. And um, I wanted to share with you real quickly. In terms of good things happening,
Yeah.
I this week I read a press release, and I'll just be very, read right from the press release, if you will. This
Great.
comes from the sonomacounty.gov
Hmm.
website. And on Monday, September 8th, they announced this: Sonoma County launches a program called Open Doors, an open doors campaign to connect residents to vital services. And
Wow.
so the first intro line was Sonoma County today launched Open Doors, a new initiative designed to improve residents' access to food, housing, healthcare, employment, childcare, and other services that everyone needs to thrive. It's going to be based on this new website, www.opendoorsSC.com.
Cool.
That's all one word. Offers a searchable directory of more than 600 social service providers
Hmm.
across 12 categories by centralizing information that was previously scattered across agencies. The website makes it easier for the public and service providers alike to quickly find the support they need.
Wow.
That is exactly what we have been talking about in
Yeah.
terms of connecting people, giving voice and an easy way for folks to get that support and that love that they're trying to access. So,
Holy cow, man. That is good
yeah,
news. Thank you for
yeah,
sharing that. Yeah, we'll
yeah,
make
of
sure to put
course.
that website in the show notes once we publish this.
Yeah.
Cool. Thanks for
So
sharing that.
I'm thankful to live in Sonoma County today.
That's for sure. Yeah, yeah, we do have a plethora of resources, and it's cool that there's a kind of a, sounds like a one-stop shop for finding those, because I know
Right.
often they're scattered, and if something's out there and folks don't know, it's not really helpful. So
Absolutely. How about
good
you, brother?
stuff.
What's been good for you this week?
Okay, so we go to every length for our viewers, right? Like we hold nothing back, right? So
Right.
this week I actually have a visual aid, Chris, for
Oh.
for my
Oh.
highlight. In
Was
the
this
industry in the
approved?
in the industry we call it a prop, but
Okay.
my adult education background, I would call it a visual
Right.
aid. But so I was
Right.
taking a walk just before, and I came across these lovely,
Wow.
lovely grapes,
Wow.
and I could tell you, oh,
That's
they
wonderful.
are
Yeah.
incredible. They are honestly the best grapes I've ever
Wow.
had in my life. And for all of our law enforcement friends watching, I did not trespass. These are on public property, readily available for anyone passing on the road. But no, they are amazing. So, I mean,
That's
often
beautiful.
I think this sharing this highlight, I love that, you share that we talk about big picture stuff, but I think often as well, I want to remember for myself that the
Mm.
simple things of the sweetness of nature that comes through and the fruit that again to your point being in Sonoma County that we have immense amounts of all around us, so there's
Mhm.
apple trees dropping thousands and tens of thousands of apples everywhere right now, the berries are in bloom, all that
Yeah, it's
stuff.
just
So
beautiful, beautiful
just
time.
a good reminder of that goodness that's happening around us all the time, right?
That's
And
right.
so
That's
yeah,
right.
and just the simple pleasure of eating a delicious grape is uh
Mm.
it's a cool thing. So anyway, a
I
little
I
silly, but it's true, right? It's
it's
really
not
true.
silly. I'm thankful for your story, brother.
Yeah,
It encourages me, to know that you were blessed that way. So,
yeah,
yeah.
awesome. All right, well, now it's time for us to introduce you to a wonderful human being who is joining
Hmm.
us from West County, in Western Sonoma County. Our friend Lupe Catalan. Lupe is going to join us from the virtual green room where she's been enjoying all of the special treats that we have provided for her. And no, welcome, Lupe. We're so grateful to have you join us today. Thank you so much for making the time to do this. I know you are one
It's
of the
welcome.
busiest human beings I know, and so it really means a lot that you set aside time to come be with us today.
Yes. A
Hi.
privilege. Go ahead. I'm sorry.
I know it's okay. Hi, Michael. Hi, Chris. Thank
Hi.
you. I'm thankful. I'm thankful and it's a blessing to be here with you both. So thank you
Hmm.
again.
Awesome.
Of
Yeah,
course. Of course.
excellent. So, Lupe, you do a lot of things. You and I have known each other for a while, and I've heard many of the things that you do. One of the things that has been most intriguing for me that you're a part of is the Russian River Promotoras. And first of all, for those of us who are not familiar with that term, can you tell us what Promotoras is, what the concept is, and what some of the ideas around that are?
So yeah, so promotoras, I think the terminology that is used in the English
Hmm.
Hmm.
side, it's community health workers. So
Uh-huh.
promotora is a community health worker.
Hmm.
One of the difference between community health workers and promotoras is that promotoras, most of their work is being done by volunteers. So promotoras are community members. They
Hmm.
live within their own community, and they help with, again, just connecting their community
Hmm.
to resources, education. As you mentioned, most of the work that I do is in West County. Um, and one of the challenges that we faced in West County, again, is that it's a rural community.
Hmm.
There's a lot of isolation. We have community members, we have seniors that sometimes are not able, again, to navigate, technology. So
Hmm.
having those promotoras de salud, community health workers, it's crucial in these communities. Most of the promotoras have been living in this community for, again, pretty much like all their life. Some of them maybe moved here, but they've been here for many, many years. So they know the
Hmm.
barriers, they know the challenges, they know what their community is needing. So that's a promotora de salud. Now we have the community health workers, and that's how I started my work actually as a
Hmm.
community health worker. I
Hmm.
was working for the local clinics here, and as
Hmm.
the beginning, it was kind of hard for me to understand what is a community health worker. Um, it was challenging for me because it was my first time being a community health worker. Most of my work prior to that had been working with private employers.
Mm-hmm.
And it was doing receptionist work, which you have some sort of customer service in there. I was also a secretary, which again, it had to do a lot with, um, dealing with different type of community members, clients.
Mm-hmm.
So I did see that connection, but I think community health worker definitely it's where I found that this is something that I love doing.
Mhm.
I was working for the clinics. I was helping the patients obviously get connected. Same thing to resources, mental health resources. If they need any housing guidance, I would help with housing also. But it's mainly connecting people to those essential needs
Mhm.
that sometimes are it's a challenge knowing about everything that we have in Sonoma County as
Yeah.
well. So, yes. And obviously community health workers, they have a salary.
Mhm.
Most of these positions also, I think it's important to mention that are um, with grants that their positions are being paid, which
Mm-hmm.
I think a lot of people sometimes don't know that. And that was something that I learned when I started working as a community health worker.
Mm-hmm.
That my position was getting paid through grants. So
Mm-hmm.
once the grant is done, the funding is done, then you're kind of your position. It's pretty much done.
Right.
So most of community health workers work for nonprofits. Promotoras, again, support the nonprofits as well, but more as a volunteer
Mm.
community member.
Mm-hmm.
So that's what I've learned doing this type of work.
Wow. That is
Wow.
that is incredible. And I love how you frame it, explaining it in, the community health worker, because I think a lot of folks understand that and can connect with that. Um, and we met through my work in peer support, which there's a lot of overlap with that. And I think there's something about that element of the, I mean, even in the word community health worker, and then you take that from a paid role to the promotoras who are doing it as volunteers.
Mm-hmm.
There's something different about that motivation versus somebody who's, and there's nothing, I mean, I love clinicians, I love doctors, I love social workers, all those different folks, but it's a different level of service, right? It's a different level of
Right.
connection. Could you maybe speak to that a little bit about how you feel the community health worker and the promotores are able to relate with the folks that they're serving in a different way than maybe some other service
Right.
providers?
I think both community health workers and promotoras have the same vision, right? They're there to connect with resources.
Mhm.
They're there to be that liaison or that
Mm-hmm.
bridge
Mm-hmm.
to help those that are in need. Um, what makes it unique about promotoras is that they are passionate about their communities. They have that trust as well because they lived in that community that they're supporting.
Hmm.
And I mean, just by doing volunteer work, I think that says a lot about these human beings
Yep.
that they're actually caring, even though there is not a salary,
Right.
right? There's no money, there's no income, but yet they're deciding to be a support for their
Mm-hmm.
community. Again, I think just showing that respect for the work that they're doing, I think it obviously it talks a lot about them as human beings, right? They
Yep.
have again the love that sometimes we um, need to be able that empathy to be
Mm-hmm.
able to do the work, not because it's a responsibility, because you're getting that paycheck every week, every 2 weeks, monthly, whatever it is, but
Hmm.
being able to do a job again that you're not getting paid. I think it's It's important to highlight that because promotoras, again, and they're not just in West County, just to let you know,
Hmm.
promotoras are all over Sonoma County. And I'm sure not just all over Sonoma County, but I've done some research and I know that this promotora role, it's in different states also,
Wow.
not just here locally.
Beautiful.
Yeah, but it's all over the United States. And I'm glad that again,
Wow.
the Good News Network, it's
Hmm.
highlighting that
Mm,
because believe me, maybe if you reach out to other friends, like from other states, just ask about community health workers, promotoras, and I'm sure this vision is now all over the United States. And
Hmm.
again, we have a lot of volunteers. We have a
mhm,
lot of community that do volunteer work. And when I hear that, to me, they're also community health workers
mhm.
because they are
Yeah.
promoting,
Yeah.
right?
That's right.
Health. So they are
Ah.
promoting, like we're here, we're supporting each other. So to
Right.
me, anyone that's out there doing volunteer work could be considered a promotora,
Mm.
or a community health worker also.
Right.
Wow, what a
And
great point. I had never thought about that, Lupe, but you are absolutely right. Like anytime we're connecting with another human being, we are promoting health, right? We are creating
Right.
health. We are
that's
creating
right.
well-being,
That's
and that
right.
makes us a community health worker.
That's right.
What a beautiful concept. Thank you for that. So a question for me, and this is one of the questions we often ask most of the folks with whom we visit is, so clearly there's something else other, as you said, a lot of these folks are volunteer. And even, I mean, for those who don't know, community health workers, as Lupe said, they're grant funded and they're often, minimum wage positions, right? Like they're low wage positions. And yet some of the, as you use the word passion, and that's what I've observed as well, is the
Hmm.
passion. So even those that are getting paid the bare minimum. And then, as you said, there are a lot of folks doing this that they're just doing it. So
That's right.
why? What is the reason that what drives
Right.
folks to do this work in your experience? And what drives
My
you to do your
experience,
work? Yeah.
yeah, and that's what I was gonna say, right? I can talk from my lived experience,
Hmm.
and I think the motivation's always that you always know someone that's in need.
Mm.
It could be a friend, it could be a coworker, it could
Hmm.
be just anyone that's crossing, through your path.
Hmm.
And when you know that that person is in need, I think just have it in your heart. I think a lot of people have that within themselves, but sometimes it's challenging also with everything that we're facing. But I think for me, it's again having that empathy, knowing that even though I have my own struggles, that even though I
Hmm.
have my own challenges, there's
Hmm.
people out there also that having those same situations. And
Hmm.
for me, being just empathetic to
Hmm.
understanding that sometimes I might think, oh, I'm like the only one that's facing these barriers.
Hmm.
And in reality, I'm not the only one.
Right.
There's
Hmm.
a lot more people out there
Of
that
course.
are even facing even greater challenges than what that the ones I have. So
Yeah.
therefore, for me, and I think also with the promotoras, that's when I talk to them. I have a lot of friends that are promotoras that are all
Hmm.
over the county. And I think that's one of the things that I keep hearing from them, right? It's like, Lupe, I'm not the only one. There's other
Mm.
Hmm.
people out there that need my support. There's other people out there that are, on daily basis, just seeking, assistance. And sometimes the only thing that these people need, again, is just someone for them to
Yeah.
listen.
That's
Like, this
right.
is what I'm struggling with. This is what I need. And I might not have an answer. I might not have the resources at that moment, but just being able to be there and to hear their needs, their
Yeah.
concerns, you're helping with their
Hmm.
mental health. You're
Yeah.
helping
Of
with that
course.
anxiety that they're facing. You're helping with, in some way, giving them hope that there is someone there to listen. So I think definitely empathy, um,
Mm.
and love, just love
Hmm.
for one another. I
That's
think
right.
it's what makes us do the work that we do
Hmm.
every day.
Hmm.
Well, that is
Hmm.
clearly evident. And so extremely inspiring. Wow, thank you so much. So I have some other
Yes.
thoughts, questions. But Chris, anything you have you wanted to check in with Lupe about and ask?
Once again, thank you. I'm so encouraged to hear your heart and hear your love. And this is, this is one of the reasons Michael and I wanted to put this little show together is just to let people know that there are people with lots of love in this community who want to help each other. And you used two words in one of your answers. You talked about bridges and liaisons, and that is such a critical piece, because as Michael beautifully showed us at the beginning of the show, we do have a lot of resource in this county, but we often don't have the bridge or the liaison to connect those people.
Yeah.
But once they get connected, then there can be a blossoming of a relationship, getting to know people, their story, and then what blossoms out of that? Unconditional love. Many times, unconditional love. And I just think it's beautiful that that model and the idea. Our world, I'm giving a bit of an editorial here, Lupe, but our world has become so isolated,
Right.
right? Through technology, through all kinds of reasons, we're so isolated. And this makes my heart say, this is what community is. It's looking
Right.
out after each other. It's taking care of each other. So again, thank you so much. I guess, can you think of one story that just puts a smile on your face in terms of the work that you're doing? And I think stories are powerful, and they send a clearer message of what we're trying to do in terms of loving our community. Is there anything you can think of like that?
Mm,
Yes, many, many
mm,
stories.
mm,
And it's great when, again, when you're help someone that was in some sort of struggle, whether maybe it
Mm-hmm.
was like finding a job, getting, PG&E bill paid.
mhm,
Um, there's a lot of stories. And I
Mm-hmm.
think what makes me happy is when I'm able again to help those that are in need and just seeing the relief when they're getting that support, whatever it could be economically, it could be mentally, it could be
mhm,
maybe physically, uh, and just being there at that time, at that
Mm-hmm.
moment,
yeah.
right? Helping that
Right,
person,
right,
not knowing who that person is.
right.
Because again, a lot of the times with the work that I do also, it's like you don't know the community. You don't know who's coming in.
Mm-hmm.
And just being able to provide that assistance, that support, and then that person coming back to you and saying thank you. You
Mm-hmm.
know, you really helped me. Um, and
Mhm,
again, and I'm going to just give you an example. Just a few months ago, I had an unsheltered person that came into my work and was in need of obviously, financial assistance. So we were able to get her connected with Medi-Cal, with CalFresh. And she was also saying that she was looking for a job. And then I remember, oh, I know this organization that is looking for,
Mm-hmm.
for
mhm,
someone. I
mhm.
printed the info, gave her the phone, and I said,
Mm-hmm.
give him a call. I know they've been, hiring, and I know they're looking for someone. So weeks passed by, and I hadn't heard anything. And then one day I came into the office and I saw a plan on my desk with a note
Mm-hmm.
Oh my
just
gosh.
saying, I just want to let you know that I'm so thankful to you. I
Mm.
got a job with the
Oh.
organization that you told me to call. And when I wrote the note, obviously I was like happy. I'm sorry.
Mm-hmm. That's okay.
Mhm,
Because
mhm.
again, it's like sometimes you don't know the difference that you're making in a
That's
person's
right.
life.
That's
And it's
right.
just great to hear, someone coming back to you and saying thank you.
Mm-hmm.
So,
Yeah.
I mean, it's great. It's wonderful. It fills my heart with joy.
Mm-hmm.
Um, and I feel thankful again that I was able to help that one person.
Right.
Wow.
Wow.
Wh-
Thank you for
What
sharing. Mm.
what a beautiful story. And as you've been talking, several times it's come to my mind, and I want to I want to highlight it that so many messages that I've heard throughout my life and that I see represented in our culture is focus on yourself, get what you need, that's what's going to make you happy. And everything that I'm hearing you saying is the exact
It's
opposite, that
opposite.
the source of happiness and the source of joy and the source of love for all of these folks is that I'm focused on what someone else needs, not what I
That's
need.
right. That's
And
right.
that's where I find my source of life, and that's where I get filled up, and that's where I find my
Hmm.
joy, and that's where your tears are coming from now, seeing the joy of someone of helping someone else. Like,
Right.
what did you get out of that? You didn't get
Right.
a job, you didn't get a raise, you didn't get right. Like you got the joy of seeing someone else
Right.
That's right.
thrive. What a beautiful thing. What a beautiful thing.
That's
And I
right.
think it is that other oriented love that is the true source of joy, right? And a lot of things will bring temporary happiness or moments of excitement or whatever, but that fulfillment, like the story you just told is going to stick with you for a long time, right? Like that's going to fill you up anytime you're down. You think about that, you'll be like, oh
Oh
yeah,
yeah.
right.
Yeah.
that
Yeah.
Yeah.
that it's
Right.
a never ending source of
Yeah.
joy. It's so
That's
And
beautiful.
right.
I have her note, the note she left me. I have it like over here on my desk.
Of
That's
course.
And it's
awesome.
again, it's just, a reminder of that the
That's
important
right.
work that I do.
Yeah.
That's right.
And yeah, that again, just touching the life of others. It's again, it's so important.
And,
Yeah.
and
There's so much negativity happening in the world, so much, that it's like sometimes it's good just to kind of see the positive and the positive that you bring again to others. Yeah, it's definitely a
hmm,
joy.
Beautiful.
wow. Wow.
Yeah.
Wow.
So I
I,
am curious. Yo, go ahead, Chris, please.
well, thank you. I didn't mean to interrupt.
Yeah.
I just want to just highlight the idea of you gave love and light to this person to help them get connected to a job. And you have created an opportunity. Not only has it lifted you up to know that you helped, but you've created an opportunity for that individual to pass it on, to pass that light and love on. And that's what we have to be doing in this community. So anyway, I appreciate the story. Thank you so much.
Yeah. Thank you. So I am curious, you're talking about the Promotores that are out there and they're volunteers, and you said they're across the county and even across the country. I mean, what the image that came to mind are like these are little love ninjas running around doing all this work. But how do we find these people? How do we find these ninjas?
Yeah.
And how do we get connected to support them and support their work doing and getting involved and to be able to help?
Yes.
Yeah,
Yes.
so again, I mean, when I started my work as a community health worker, I this was through the local school here in Guerneville. And these were just parents bringing their kids to school. So
Hmm.
me learning again, like what a community health worker was about, and then just being that guidance for them. Like,
Hmm.
there is so much that we can do for the community that you lived. And then again, just passing that on. So again, Michael, if you want someone to be a promotora de salud, it's just being able to let them know again, do you have again that love to help your community, right?
Hmm.
Do you
Hmm.
have that empathy to know that if someone's out there needing support, that you're going to be that one person reaching out to them. So I think promotoras, again, you can find them anywhere.
Mhm.
We can start those conversations again, even with our friends, right?
Hmm.
And just bringing that support, that connection within our own community. So my connection again with the promotoras here, that's how it started. Just parents that were bringing their children to school. We started a small group. We had our cafecitos.
Mhm.
It was just a morning reunion with the parents, having coffee, just talking about, same thing like what are their challenges? How is your day? What
Yeah.
are the things that you need? And this is how we started with the promotoras in West County.
Wow.
Just parents talking about their own lived experience,
Hmm.
talking about their challenges, and how do we find solutions for those challenges that they're having. And then I think, Chris, you said that, right? And then them bringing that into their community because they were
Exactly.
able to face those challenges with the lived experience. They were able
Mm-hmm.
to find those resources by themselves.
Mm-hmm.
So they did get empowered to be able to say, now I can do this for someone else. So it's
Exactly.
like paying it back, right? I got this from someone else, and I can bring that into someone else. So
100%. Yep.
again, I think you can find again promotoras anywhere you go.
Mm.
So I
Hmm.
hope that answers the question.
It does. You know, it's almost. I'm thinking of this concept that, I did Tai Chi for a number of years, and my instructor used to say, simple, not easy, right? It's like showing up and what does someone need, and just making an intentional connection and providing an opportunity for people to get together to talk about what's going
Mm-hmm.
on, and then
Mm-hmm.
supporting whatever that is. I think, I've done a lot of work in behavioral health, and often I think we overcomplicate things and we try to build these whole structures and all of these programs and all of these things, and it's like there's so much time and energy spent before you even actually start to do anything. Whereas
Mm-hmm.
if you just turn to the person next to you and say, "Hey, what's going on? What do you need?" Right?
Exactly.
And
Right.
how can I
Exactly.
help? And maybe I don't, maybe not me,
Yeah.
but maybe I know someone. It's
Right.
just
Right.
Right.
such a beautiful concept of that really just reminds me. I mean, I grew up in rural central Illinois, and it just reminds me of that small town mentality of we're all in this together. Like if we're not doing this for each other, it ain't getting done, right? Like we got to
Right.
figure it out. There's no hero showing up to take care of this for us. Like this
That's
is what
right.
needs to happen.
That's
And
right.
how empowering is that? How beautiful and how
Yeah.
empowering, and how
Mm.
much, I mean, I hear the word community talked about so much, and yet this is it. This is it.
Mm.
Just being there for one another and building those connections. So
That's right.
awesome.
Yeah.
Yep.
And I think one thing that I also want to highlight, again, as you know, for promotoras or community health workers, obviously, we don't have the magic wand to fix
Hmm.
everything,
Hmm.
right? And then through our journey, through our path, doing this type of work, we're gonna find also those people that they're not ready, right?
Mm-hmm.
But at least
Hmm.
being able to say and just leaving that whatever resource you might think they need, just leaving that information with the person and then just kind of moving on. I think it's
Yep.
Mm-hmm.
important because as
Yep.
again, as promotoras, we don't again pretend that we are saviors for everything
Sure.
or
Right.
we have the answers for everything, but we are again there to support in whatever way that person, that community member needs it.
Mm-hmm.
And if they don't, then it's nothing personal, right? I
No.
mean, they're
No.
just
Yep.
not ready to get the help that they need.
That's
And I
Mm-hmm.
right.
think sometimes again with like you're saying, Michael, with behavioral health, or when you go to a doctor's office, it's like sometimes I feel like they try to say, this is what you need to do. And
Hmm.
these are the rules, and these are the guidelines, and you need to take this. And it's like, well, sometimes people are not ready.
Hmm.
Sometimes are,
Mm-hmm.
people, they have like their own way of processing and doing things. So I think again, we are more about supporting you in your journey and the help that you need. If we're able to help and assist, we'll do it. If we need to get you connected to someone else, we'll do that. But again, at the end, it's like we have respect. We have that respect for that community member that we're helping.
Yeah. Oh,
Right.
beautiful. Thank you so
Wow.
much.
That's
Uh,
well said.
yeah. I mean, this is beautiful. I am so encouraged, and I mean, like I said, you and I have talked about this a number of times, and I've known you, and we've talked about the Promotoras. I've met many of them, I've been in conversations, but I have a whole different perspective around this now. So I am super grateful for this conversation, and you sharing more about this to help me get clarity, and to bring this concept and this idea to our viewers who can now they could be promotores. Like I love, because in my mind it's
Exactly.
like, oh, there's these groups of people. It's like, no, like you said, it's just people helping people. That's what it
That's right.
is. It's so
That's right.
beautiful, and
Exactly.
we can all
Yeah.
do that. So let's all
Yep.
go be love ninjas and promotores,
Okay.
Yeah, yeah, yeah.
Wonderful.
Any other
Mm.
good news you want to share with us? Anything going on personally, or anything else that you want to share that's good you want to share with folks?
Well, I just want to also highlight what Chris mentioned about the open doors.
Uh-huh.
I mean, I work for the county,
Hmm.
and I think it's a great, again, it's a great resource, and I love just the title Open Doors
Yeah.
because,
Hmm.
again, I think it does highlight the many resources that we have in the county,
Right.
and it's also going to be led or managed by community health workers
Oh,
within the
wow.
county also. Yeah, the Department of Health Services, they have also community health
Wow.
workers. So
Cool.
whatever update, if there's any challenges, if there's any barriers, maybe connecting to those resources that are
Hmm.
being mentioned on open doors, then there's going to be community health workers trying again to support those clients, community members, patients,
Hmm.
whatever you want to call
Hmm.
them. If there's
Yeah.
any sort of barrier,
Wow.
then they're going to be there to support navigating with open doors. So I think, thank
Oh,
you, Chris, for
beautiful.
highlighting that. I think it's going to be a great resource for many, many community members. And then again, I think this is something also that I talk to the promotoras to guide them and then give them
Hmm.
that resource to say,
Hmm.
now open doors. You can just type in whatever you need. It's going to highlight the many resources that we have. And then as promotoras, we can help with making that call,
Right.
right, to whatever services they're looking for, and then
Wow.
providing that information to the community. So I think,
Wow.
thank you,
Of course.
Grace, for highlighting that. And I'm hoping that more people will be aware that we have open doors
Yeah.
and that it's there for, to be
Well,
used. So
I'll be talking it up. I know
Yeah.
at least in my community there'll be three people that will hear about it. But seriously, I will be talking it up. So thank you.
yes, thank you, Chris. And then if it's okay, I can also share my number because one of the things that I always want to hear also from the community is the feedback. Is it
Hmm.
Hmm.
working? Working? Is it not working? If it's not,
Hmm.
if it's not working, why is it not working?
Right.
I think those things are important because if we don't know that it's not working, then how are we going to be able to fix it?
That's right.
Exactly.
So again, I think if
Hmm.
if I can share my info, I don't mind doing that.
Yeah, for
I
sure.
think I would like to hear from the community what they're feeling about open doors, and then
Hmm.
being able to provide that feedback also to Department of Health Services.
Hmm.
So my number, it's
Yep.
work number 707-565-4683.
Okay.
And again, I'm bilingual, so people can call me, Spanish, English. And
Great.
then my email,
Uh-huh.
it's Lupe, my first name, Lupe, dot, last name Catalan, C as in Charlie, A as in Apple, T as in Tom, A as in Apple, N as in Lima, A as in Apple, N as in Nancy, Catalan at Sonoma County dot gov. GOV. So
Excellent.
again, I think as people start using these resources with open doors, if there's any challenges that they're seeing, I think it's important for us to know. So thank you, Chris, again
Excellent.
for sharing that.
Of course.
Yes, that wonderful news.
Of course.
Fantastic. Yeah, and we'll make sure to put your phone number and email in the show notes as well, so folks can access it through that
Hmm.
way in case they
Hmm.
weren't able to write it down when they heard it. So, how beautiful. Wow. What a great conversation.
Yeah.
Lupe,
Thank you.
I am so grateful for you. I am so grateful to know that you're out there and all the work you're doing and just the thank you for being you. You are always a source of inspiration and hope for me. So thank you. Thanks for coming and sharing.
Thank you,
Muchas,
Mike.
muchas gracias.
It's a blessing. So thank you. It's an honor to be here, Michael. Thank you also for all the work that you're doing. And again, thank you for highlighting the important work that the promotoras are doing. Not
Absolutely.
many people know, so I really thank you for highlighting
Mhm.
um, them. Obviously, I part of, that group also as a
Mhm.
volunteer,
Mhm.
but I think not many people again know what they
Mm.
do. And I think it's important that they know that we have promotoras, volunteer people that
Yeah.
are waiting, for
Hmm.
them to reach out and to be able to be a support in their community. So thank you so much. Thank you, Chris,
Of
for your
course.
time. Thank you both.
My
It's it's
pleasure.
it's it's been great being here.
Yeah.
Yay. Thank you so much, Lupe.
All
All
right.
right. Well, we will
Mm.
talk to you soon. Thanks and enjoy the rest of your day. All
Okay.
Thank you.
All right.
right.
Adios.
Bye-bye. Wow.
Wow. If
I
that doesn't, if that, as an old pastor said, I think one time, if that doesn't light your fire, your wood is wet.
I'm telling you, man,
Right?
that's
Yeah.
and just I'm marveling at my own ignorance right now because like I said, I've known her for years. We've talked about the Promotora so many times, and only now in this conversation did I really get the concept that it's not
Mm,
an organized group. I mean, it is. There's groups of people that do this,
right.
but it comes out of just people really just saying, who are you? What do you need? And
That's
how can I help? I
that's
mean,
right.
that's how community gets built. It's
Hmm.
not a program or a process. I mean, it's just people being exactly what
It
you,
starts with a relationship,
yeah, totally.
right? Not resources first,
That's right.
relationship.
Yeah, thank you. That is a great way of putting it. 100%.
Hmm.
Wow. I love it. I love it. Well, my goodness.
Wow.
If yeah, that is a I feel both extremely encouraged and also very challenged
Mm,
to be doing having more of those conversations with folks that I'm interacting. So
right,
I
right.
really look forward to
Me as well.
um accepting that challenge and just and becoming a
Mm.
promotora, which I never knew could be.
I have
So,
faith in you. Yes.
well, thank you, Chris. I appreciate it. Well, before we wrap up, so what are you looking forward to? I heard something about a birthday or something coming up.
Yeah,
What's going
I'm
on there?
it's my wonderful wife's birthday, Friday,
Oh,
and we created a tradition. I don't know how many years. It's been many, many years. And I always felt that birthday was not enough. So
uh-huh.
I started birth week. And
Okay.
so I start back, about 7 days before the actual birthday. And the
Uh-huh.
truth is, I look forward to it because it gives me that structure maybe that I need to show somebody, what, I love you so much
Mm.
and I care about you and you're essential to me. And it's a small effort just to tell her that I appreciate her.
That's beautiful. And it's a great way to wipe the slate clean, right? And to to help her forget about the weeks leading up to it and all the
That's
ways that
excellent point. Excellent point.
No, I
Yeah.
make light of it, but I really appreciate what you said that it's a day's not enough to show your appreciation, your love for her.
Hmm.
So even though I'm
Hmm.
making light of it, I am touched and
Hmm.
it is a beautiful expression of who I know you to be and who you are for me as well. But
Yeah.
just to do that for your spouse, for someone that you're living
Yeah.
life with and building life together. Thank you for sharing that.
Of
That is a
course.
beautiful example.
Of
Yeah.
course. You're welcome.
Yeah. Well,
How
I
about
will
you?
say nothing nearly as touching or meaningful as that. However, what I am looking forward
Oh.
to is this we 2 times a year um I get the opportunity to gather. So I support 7 different peer programs, and once they're all doing fantastic work, similar to what Lupe was talking about, the community
Mm-hmm.
health workers do. However, they're all spread again across these different programs, and they don't get to interact with each other. I get the blessing of knowing all of them because I get to move between the programs in my supportive
Okay.
role.
Sure.
So one of the things several years ago was I was like, these folks need to be in a room and be able to appreciate each other and be able to
Mm.
learn from one another. And so
Mm-hmm.
2 times a year we all get together. We call it a all peer staff development and team building day.
Hmm.
And we spend the morning on a training topic, going a little deeper, and then in the afternoon we just do something fun together that has a team building
Very
aspect
cool.
to it, a connecting
Mm-hmm.
aspect to it, but really the
Mm-hmm.
idea is just to have fun together
Right.
and not be connecting specifically around work and just, getting to know one another more as individuals and as human beings so that we can be doing our work more effectively by having deeper connections. So
Yeah.
that is coming up. And I am transitioning out of this role fairly soon. And so this will be the last one of these that I get to lead. So it's sort of a bittersweet thing, but I am very
Mm.
much looking forward to it. The person who is moving into my role she works within our organization in these programs as well. So she'll be there. So this is sort of a
Yeah.
handing off of
Transition.
the
Right.
torch to her,
Right.
and
Right.
been able to work with her in collaboration building up to this thing. And so I'm excited about it. It'll be a lot of fun. It's going to be at a location someone that we will be inviting to join us here on the Good News Network, Life on Art. They have a fantastic
Great.
program, and they are providing the space for us to do this. So yeah, I'm very much looking forward to that.
Wonderful.
Yeah, that'll be
That's
great.
that sounds great, brother.
Yep.
I mean, and the way you described what goes on in those during that time with your staff, with the staff, that's relationship building that's
Yep.
critical to the to
Exactly.
thriving the community. It's the model that we as even small local neighborhood communities, if we could do those things together, wow.
Yeah.
I mean,
Yep.
you'd build relationship and then there comes the love, right?
That's right. Yeah, and do
So,
and around doing something fun too, I think was one of the things that the
exactly.
managers and often it's like so serious of how do we build a team and all this. It's like, well, have fun together and those connections get built. Brain science
They
just shows that when serotonin's
It
happening, people
works.
are connecting, right? So it's
That's
cool.
right. That's right. Yeah. Good
Awesome.
for you, Michael. Well, I look
Thank you.
forward to seeing you next time and
Yeah.
hope you have a wonderful week.
Yeah, you as well. And thank you all for joining us. I cannot imagine that you are not encouraged and inspired by our story today. I'm grateful
No,
that you joined us to be a part of that and to hear about that. And I will encourage you all to go out there and be a promotoras for those in your life as well. And we will see you
that's right.
next
Amen.
time here on the Good News Network. Again, as always, we'll put the information in the show notes so you can get in contact with Lupe if you would like to know more. And in the
Great.
meantime, please keep looking for the good. And if you don't find it, be it.
That's right. Bye
All
bye.
right.